Good morning, good afternoon, good evening. I'm Dr. Rosalind Shaw Belt, and I'm a director with American Workers Insurance Services. I want to share some information with you about the number one dental HMO in the country. American Workers Insurance Services is a licensed and registered insurance agency. We're in 40 states and 2 territories. Our program was established in 1983 by a group of doctors to market affordable association healthcare benefits. Our Vice President of Marketing is Mr. Willie Martinez. AWIS itself, we call it AWIS for short, for American Workers Insurance Service. We have an A+ rating with the Better Business Bureau. We make available to our members limited group health and dental insurance benefits. And again, we've been in business for 30 years as of last year. Health insurance is a very serious problem that we have in our country. We understand that 160 million Americans today don't have dental insurance. Because of the Affordable Care Act, there are more people trying to get health insurance of the 49 million Americans that didn't have it. But dental insurance is still a major situation. Doctors are saying that dental illness can lead to serious medical illnesses, and there are documented proof of videos that are on YouTube of children who have died because of tooth disease or tooth infections. There's a 24-year-old gentleman that was Boosie Collins' nephew who died of a tooth infection. He went to the dentist without any dental insurance. The dentist gave him 2 prescriptions, one for his pain and the other for his infection. When he went to fill the prescription, of course, he didn't have enough money to get both. So which one do you think he got? He got the one for pain. And the infection went to his brain and killed him. So that shouldn't happen in our country. We live in a society right now, because of new health care laws, because of the health care reform and the Affordable Care Act, that everyone has to have health insurance. And there are 10 essential benefits that are required for every plan that is out there, whether you get it from private insurance or whether you go to the healthcare.gov website and purchase that. Those 10 essential benefits are ambulatory patient out services, emergency service, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices, lab services, preventive and wellness services, and pediatric services that include oral and vision care. So one of those essential benefits is dental for children. Now, that does not include dental for adults and for families. And we are fortunate that we have the number one dental HMO plan in the country. So whether you're getting just dental alone or whether you're getting dental to fulfill the necessary requirements according to the new health care laws, we have the number one dental HMO plan. We have a dental plan that there is no waiting period for any pre-existing conditions. So if you've already been diagnosed with something, gum disease or some kind of thing concerning your teeth or your gums, some plans out there make you wait 30, 60, and 90 days before they'll allow you to get major work done. With us, there's no waiting period for those pre-existing conditions. We have the largest dental network in the United States, over 189,000 dentists. Our provider is Delta Dental, Delta Care. And they've been in business since 1954, and there's not a dentist that does not know who Delta is. Our copay schedule, what you pay for the procedures of the dental work, is the same copay schedule that the U.S. active duty military members are currently using. We have an exclusive contract. And the wonderful thing about this dental HMO, there are no health questions. There are no age limits. Families can get our dental plan for their children up to age 26, and then at that point they can get their own dental HMO plan. And then those people that are over 65, where a lot of plans stop at that point, there are no age limits here. We had someone that just got a dental plan that was 100 years old. And we're already serving over 25 million customers. Now we're talking about the kind of dental plan that you can have detailed oral exam at no cost, x-rays at no cost for the life of the customer. The office visit is $5. You get your teeth cleaned for $5 every 6 months, your routine teeth cleanings, and that's for every single family member. Fillings for $8. And then those major things that need to be done. A lot of times when you haven't been to the dentist for any period of time and You need things like root canals and crowns. Those are the things that usually hurt an individual's pocketbook. Our root canals start at $165 to $365. Our crowns from $185 to $395. Dentures, $365. And then braces. I have friends that have gotten braces for their children, and that cost $3,000, $4,000, and $5,000. And our braces start for children at $1,150, and for adults at $2,100. And then the person that invited you to watch this, they have a website where you can download the entire copay schedule. Every procedure that the dentist will do that is a part of our plan, you can find it and download it and take a look at it. It's about 12 or 13 pages, and you can look at that prior to getting our plan. Can you afford $39.95 per month for the best dental HMO plan in the country? Absolutely. For a single person, $39.95 per month in most states, and for a family, $89.95 per month. Both of these have a one-time $60 application fee, and because you must join our association, you pay $12 per year to join our association so that you can get these group type rates. Now, some states have it a little bit more, $10, $20 more than the others. And here you see a list of the states where it's $39.95 for a single person, $89.95 in Arizona, California, Florida, New Jersey, Pennsylvania, Texas, New York, and Maryland. In Georgia, Hawaii, Kentucky, Nevada, New Mexico, Ohio, and Tennessee, the rate is $10 more for the individual and the same price for the family. In Indiana, in Louisiana, Mississippi, Rhode Island, Utah, Virginia, Washington, it's $10 more than that, and $119.95 for your family. And then in Colorado, Oklahoma, and Oregon, it's $69.95 per month and $119.95 for your family. And once again, everyone that gets one of our plans must join our association. Our association is called NAP. It stands for the National Association of Preferred Providers. And that's $12 per year per family. Now we also have what we call a Dental HMO Plus. And in many states it's called the Optima Select. In some states it's called different other names. And this is the price in most of our states. For a single person, $124 per month. And for families, $154 per month with a one-time application fee of $100. Plus, again, join NAP for $12. Well, what's the difference in this and our basic dental HMO? Well, it includes some medical benefits as well. It includes not only the dental HMO, but it includes a $50 reimbursement when you go to the doctor. So in the event that you go to the doctor and let's say you have a copay of $30 or $40 or $50, we will reimburse you 5 times a year for any sickness or illness that you go to the doctor per family member. So if you go to the doctor for $40, your copay is $40, we're going to reimburse you $50 each and every time. If you have an accident, we're going to pay for that accident up to $5,000 per accident. And all you have to pay is a $100 deductible. And that's any hospital, any emergency room. This plan also has a $10,000 accidental death and dismemberment. It has a $100,000 per person emergency travel assistance. It has some pet care discounts. And then it has the Patient Advocacy Center. That's PAC. And what PAC does, in the event that you're stuck with any kind of bill, whether it's a medical bill, hospital bill, any other bill, you can turn that bill into the PAC department and they will go to work for you, because many times you're overcharged, extra charged, duplicate charged, and the PAC department gets results. And they do their best to either get your bill reduced or sometimes even eliminated. We have testimonies of people having over $600,000 medical bills, and the PAC department, after working on it for 4 months, completely got that bill eliminated to $0. There are other times when they've gotten it reduced. To one lady, she had a a $17,000 bill. They got it reduced to $900. It was still too much for her, and they got that into arrangements for her to be able to pay $10 per month. So that's what the PAC department does. So please get back with the person that invited you to watch this and ask them, how can I get signed up for the best dental HMO in the country? Thank you. Bye-bye for now.